Thank you, Eliezer. And now we'll turn to Dr. Alison Cernich from National Institute of Child Health and Development.
Thank you all for the opportunity. We're just going to highlight, and I also want to thank Nora for highlighting with just 3 minutes. It's very difficult to get through the placental research. So Nora, thank you for highlighting some of the issues around vertical transmission. What we will point out is that we have been very engaged. As many of you know, Down syndrome is one of the leading causes of mortality, or one of the leading diseases associated with mortality in COVID-19. As part of multiple different efforts that we do in coordination with the Office of the Director and from the National Institute of Child Health and Human Development, we are doing a great deal of work in Down syndrome. One of those is funded through RADXUP, which has been mentioned, that is supporting the health and well-being of children with intellectual and developmental disabilities, looking at diagnostic testing in special education settings in the St. Louis area. Another is that we have pushed forward urgent competitive revisions and administrative supplements through the INCLUDE program. And this is a large-scale program run through the Office of the Director and generally administered by the institutes, looking at various impacts of COVID, both from a pathology standpoint, as well as the interaction in terms of the genetic susceptibility to more severe COVID-19 presentation in individuals with Down syndrome. We are also deploying some COVID-related questions through the Down syndrome registry, DS Connect, so that we can get an idea from the community of the impact of the pandemic on individuals with Down syndrome and their families. Similarly, we are looking at, in collaboration with colleagues at NHLBI and at NIAID, we are looking at children who have multi-system inflammatory syndrome of children. That's been the more severe presentation of COVID-19 in children. It seems to be a post-inflammatory reaction that can happen even in asymptomatic children post-exposure to SARS-CoV-2. We are looking at the long-term impacts of MIS-C on these children. We're also trying to understand the treatment effectiveness of the pharmacotherapeutics that we have in this population. And we're also looking from the NIAID perspective at some of the immunologic variants or expressions that make children more susceptible. We also have just launched a new initiative called Prevail Kids, which is predicting viral-associated inflammatory disease severity in children with laboratory diagnostics and artificial intelligence. These are large-scale cohorts looking at how COVID-19 is affecting children, and then using advanced machine learning and other computational approaches to better understand who is at risk for more severe disease. And finally, many of you may know that NICHD is also the home to the National Center for Medical Rehabilitation Research. They have an existing notice encouraging applications on research on rehabilitation needs associated with the COVID-19 pandemic, with more severe presentations or even in post-acute COVID. We recognize that rehabilitation approaches may be a specific treatment that is of interest, and so we do welcome research in this area. With that, I will close and thank you for the opportunity.